Hello divers, this is Dr. Kang, the scuba diving story again, and today I want to talk about Eustachian tube or auditory tube, and it's also called the pharyngotympanic tube. So to start the discussion, I would like to go from the terminology, anatomy, function, which is physiology, and dysfunction, and as well as some of the treatment options we have. As of terminology, we have three different terms which mean the same. So the first one, most commonly used, should be Eustachian tube. Auditory tube is more medical term, just like a pharyngotympanic tube. Pharyngotympanic tube, as the name goes, it connects pharynx and tympanic cavity. So, but somehow, even in Korea, people call it Eustachian tube, Eustachian more often. Eustachian tube comes from an Italian anatomist called Bartolomeo Eustachi. He lived in 16th century, but in 18th century only, the anatomists gathered around and decided to call this anatomical structure and named after the one who found it. So became a Eustachian tube. If we take a brief look at, I'm sorry about the whole thing, but it happened because I tried it before, but I didn't make it, so I still have all the markings. The middle ear, if enlarged, look like this, and we have a tympanic membrane, three bones called ossicles, which leads to excuse me, which leads to cochlea and semicircular canals, hearing and balance. And then there is a cavity leading to nasopharynx. This is the Eustachian tube. Look at this. This is the middle ear cavity, and it connects to the nasopharynx. So if we put some dye in the middle ear, it should be flowing out like this. Again, anatomy. This part is called inferior turbinate of the nasal cavity, and at the end of the inferior cavity, turbinate has the opening of the Eustachian tube. It's called the natural ostium of Eustachian tube in nasopharynx. So it is a nasopharyngeal orifice. It had some bulging, so it's called the torus tubarius, and it is a cartilaginous joint which also have some muscles that opens and close the Eustachian tube orifice. Well, this is it's about rare cases, but sometimes when I have patient suffering from very difficult Valsalva or whatever equalization, I burn this posterior part of inferior turbinate with laser. Then as they shrink, the opening kind of gets widened, and I have several couple cases which treated the problem, but it doesn't always happen, but it's possible. Now the function of ET maintains equal pressure between middle ear cavity and nasopharynx. Most of the time it is closed because both sides have the same pressure, but when you swallow or when you yawn, when you wiggle your nose, the nasopharyngeal orifice of the ET opens voluntarily. ET is also a passage for the mucus or secretions from the middle ear into the nasopharynx. And thus, ear, nose, throat becomes one medical specialty because of Eustachian tube. Eyes are not connected, so let go of the ophthalmologists. Children under the age of 7, sometimes 6, sometimes 8, but the structure of a Eustachian tube is horizontal like this. When you grow up, your ear goes up, so it becomes a little diagonal, which means in children, the infection of nasopharynx, end of nose, for example, like a common cold, acute tonsillitis, maybe some allergic nasal disease, the infection goes readily to the middle ear. So, childhood, kids suffer a lot from middle ear effusion, and if those effusion becomes inflammatory, they become acute or chronic middle ear otitis media. So when ET does not function properly, like I told you, the kids can get more frequent otitis media. Divers will get barotrauma. Rarely, some babies are born with dysfunctional ET. For example, very narrow ET, or it doesn't open readily when we yawn, swallow, or wiggle. This can lead to a permanent or long-term middle ear problem. Or some people have a patent ET, which means it's open all the time. It should be closed and open only when we need, like descending, or when we yawn, when we swallow. But if you have a patent, constantly open ET, you have a more problem than simple dysfunctional ET. People really suffer from it. Like you always hear your own breathing sound. Some people even hear some ear ringing, so-called tinnitus. So this, somehow doctors try to treat it, sometimes successful, sometimes even it doesn't succeed. Smoking certainly can cause dysfunction of microcilia, which is a very small or microscopic hair existent in all airway, including ET, and also surface active substance that is present in all airway. Smoking can kill the function of them, which means you will have problem with the function of ET. Don't smoke. Here's some medical aspect. Middle ear effusion. Doctors, ear, nose, throat doctors, including myself, get tempted to do the operation for them, especially when they last like a month, 2 months, sometimes 3 months. Books say different things. Wait 2 months and then do the operation. The operation is usually Myringotomy, where you cut through the tympanic membrane and suck out whatever is inside, and then we insert a ventilation tube. This I don't like, because because I'm a diver. Usually this procedure can help and take care of the situation completely, but in a very rare cases there is some secondary infection to the tympanic membrane. There is a secondary infection in the middle ear leading to permanent chronic otitis media and perforated tympanic membrane, which means you cannot dive at all. So I delay it as long as I think it is safe. I don't rush for the operation. And if you are a diver and if you have a kid and the kid have a problem like this, you also have to put it into consideration. That's my my approach to childhood middle ear effusion. Sometimes recently doctors do some operation inside the ET. We do a microdebridder operation. It's also called the Eustachian tuboplasty. This also I don't like personally. The same thing happens. It can really help patient, but if the scarring happens inside the ear and completely block the ET, that means diving is gone. Also, there's other problem with it. So be very careful when you choose to do it, doctors and the parents. So let me stress again, you may not be able to dive after myringotomy with consequence, which is secondary infection. So take it as the last resort. So today I talked about the Eustachian tube, auditory tube, ET, pharyngotympanic tube. So what's the terminology? And we looked at the anatomy, function, dysfunction, and the treatment. So one last thing I like to stress. When you do any surgical procedure to your Eustachian tube and or middle ear, always bear in mind that there's a very serious consequence of not being able to dive for the rest of your life. So if you're not gonna dive, it's okay. Just go ahead, cure the disease. It can be cured and you can dive again, but in a rare case, no, not at all. So it was today's subject, ET, and hopefully next time I will talk about the equalization techniques, equalization complications, and please wait a couple days. This is my phone number in Korea. The area code is 82, so it should be like 821045. You can call me anytime you come to Korea, or you can call me from abroad as well. And this is my email address. If you have any question regarding this video clips, you can write me an email. If you use the KakaoTalk SNS, it's a Korean like a WhatsApp, you know. But this is a very very good SNS. So if you download KakaoTalk, you can search me with a dive log and D is capital. So if you want to put me on the WhatsApp friend, 821045009113 is the numbers. Thank you for listening, and I'll see you again.